All right. Thank you so much for joining us today for our media availability. Today, we're going to talk about the exposure notifications update. And I'm now going to take it to introduce our presenters. So today with us.
Excuse me, I'm sorry to interrupt. This is Mary Ann Goodland with Colorado Politics. I was kicked out about 10 minutes ago. Can somebody undo that so I can get back in and see the visual?
Oh, yes, Marianne, if you jump out and maybe try and log back in and we can.
I did. I've tried it several times and I get the same message that says that I had been kicked out and will not be allowed back in.
Oh, okay.
You are unable to rejoin this meeting because you were previously removed by the host. That's the error message I get.
Oh, okay. Well, Marianne, let us try and work that out. We are recording this, so we will definitely send it to you so you have the slides, but Ben will help us out and we'll try and fix this for you. I'm sorry.
Okay, thanks very much. Appreciate it.
All right, thank you. Okay. And everybody else is able to, if anyone else is not able to see the slides, please shoot us a chat and we will try and make sure that you are all good to go. All right, joining us today, we have Dr. Ginger Stringer, MPH, PhD, Epidemiology Response Program Manager for CDPHE. And we also have Sarah Thunberg, Special COVID-19 Advisor, also with CDPHE. And now we're going to take it over to Ginger. Next slide.
Good morning, and thank you for joining us today. As our COVID-19 cases are rising, we wanted to take this opportunity to give you an update on our data. Coloradans have been diligent about following public guidelines when cases rise, and we need them to do that again now. The rapid increase in COVID-19 cases and hospitalizations that we're seeing in Colorado is also occurring in many states across the country. This figure shows you our case counts over time, and you can see that we've had 3 waves of illness. The first wave in the spring, another peak in July, and now a wave in the fall. At this point, we are at our highest case count since the beginning of the pandemic, and this week we hit the unfortunate milestone of 100,000 reported cases in Colorado. Colorado has been working hard to increase testing availability to capture more cases, and we want to keep that going because it gives us information and power to help mitigate the virus. We want everyone who needs a test to get tested. We advise that if you have been exposed to COVID-19 but don't have symptoms, that you get tested 7 days after that exposure and quarantine for a full 14 days, regardless of the test result. If you have symptoms of COVID-19, you should get tested immediately. Next slide, please. This figure shows our hospitalizations over time. You can see we're also having a rise in COVID-19 hospitalizations, which is creating pressure on our healthcare system. Again, you can see those 3 waves of illness reflected in our hospitalization counts. With current transmission rates, we could see levels of hospitalization similar to April happen in the next few weeks. One thing the public can do now to help ensure our hospital capacity isn't overrun is get a flu shot. CDC recommends that everybody get a flu shot before the end of October, so now is the time to act. This will help prevent flu-related hospitalizations, allowing hospitals to conserve capacity and resources. Next slide, please. This graph shows our positivity rate over time, which is an indicator of if we're doing enough testing and how much transmission is happening in a community. We typically want to see the positivity rate under 5%. And that means that we are both doing enough testing and that there is a limited amount of transmission in the community. You can see in the last few weeks that we have increased our positivity above that 5% threshold, and it's continuing to increase. There are over 50 community testing sites around the state, and testing is absolutely fundamental, but it's not the only answer. Next slide, please. As you can tell from these data, we're at a critical juncture. There are many things that we are asking all of Colorado to do to reverse the trend of transmission that we're on. Avoid large gatherings, limit in-person gatherings, stay home when you're sick, physical distance, staying away from people who are not in your household, wear a mask, wash your hands frequently, and follow public health recommendations for testing, isolation, and quarantine. Anyone who may have been exposed to the virus but does not have symptoms should get tested about 7 days after that exposure. If you were exposed, you should quarantine for a full 14 days regardless of test results, and people who have symptoms should get tested right away. Next slide, please. The next activity that we're adding to help reduce transmission in Colorado is activation of exposure notification on your smartphone. I'll turn it over to Sarah Thunberg, who is the project lead for the exposure notification, to talk more.
Thanks so much, Ginger. So as Ginger said, we are at a grim milestone in Colorado. Exceeding that 100,000 cases is a sad day, but we are excited to say in this difficult time that we continue to add strategies to contain COVID, strategies to help us as we go along here. And one of them is the new Colorado Exposure Notification Service. This service was developed in partnership with Google and Apple, and it helps us slow the spread of COVID-19. It's an opt-in mobile phone service that allows users to alert individuals that they might have come close to should they be positively diagnosed with COVID-19. And knowing about this positive exposure helps people take immediate steps like testing and isolation and quarantine that limit the risk of exposure to individuals in their communities. Next slide, please. New research out of Oxford University indicates that any level of adoption of this exposure notifications technology is valuable. But if 15% of our total Colorado population enable exposure notification, we can reduce infections by 8% and reduce fatalities by 6%. These are game changers in this landscape of increasing infections and hospitalizations. Next slide, please. We launched this service on Sunday, and so far, more than 500,000 Coloradans have enabled the service. That's over 10% of our total population. Of those with smartphones, it's more than 15%. It's not enough yet, but we are getting there, and we are grateful for the partnership of each Coloradan who's added their phone to the fight against COVID. Next slide, please. So we encourage everybody to enable exposure notifications. If you have an iPhone, you can do that by going to your settings and enabling it there. If you have an Android, you can go to the Play Store and download the Colorado Exposure Notifications app and enable service there. If you have any questions or need a tutorial, troubleshooting, or any other information, please go to addyourphone.com. Next slide, please. Back to you, Heidi.
Great, thank you so much. And so now we're going to go ahead and take it over for questions. We use the raise hand function. And so if you have a question, if you want to go ahead and use that, and then I will call on you. We ask that you say your name and which outlet you're with before your question. I would also ask that if you have any questions that are kind of outside of what we talked about today, or maybe a little bit lengthier, need a lengthier response, please send those over to media_info@state.co.us. Great. And our first question, I'm going to go to Ray.
Hi, thanks for taking this question. There's some pretty impressive numbers for people who've added their phones to the fight. Can you please clarify how many active users we have and what, how you measure whether someone is an active user versus someone who downloaded it and maybe deleted it the next day or has their Bluetooth off?
So due to the privacy forward nature of the service, that's not data we keep. It's not data we can even access. The data we can have is how many people have enabled the service. We really are privacy forward here. And so that's the best data we've got.
Great, thank you. And Vincent, I'm going to take it to you. If you don't mind saying which outlet you're with, that would be wonderful.
Hi, can you hear me? This is Vicente Arenas with Fox 31. I just want to make sure you can hear me. Can you hear me?
Yes, we can hear you.
Okay, thank you. Can you tell me how many or if any notifications have already been sent out to people who have signed up for this service? For example, if someone has volunteered to say they have tested positive for COVID-19, has Colorado already sent out notifications to people saying they may have been exposed? And if so, how many notifications have been sent out?
So we don't actually send the notification itself. When somebody tests positive and we ask them if they would like to send the notification, we then provide them with a text message with a link that enables them to do that. And yes, we have seen a huge number of individuals over the course of their case investigation and contact tracing process already request that.
Great, thank you. Taylor, we're going to take it over to you, and if you could say which outlet you're with.
Yes, hi, Taylor Summers for NBC News Radio. Is there any telling how long it will take to see if the notification system is impacting our case rates, and if that's relating to bringing down our percent test positive rate?
I'll start here and then ask Ginger to add in maybe some color commentary. One of the things that is a nature of COVID-19 is that there is no silver bullet. We have to layer together many interventions. And because it's an urgent public health crisis, we layer together those interventions all at once. So it will ultimately be pretty difficult for us to retrospectively tease out which amount of disease reduction was a result of exposure notifications, what was a result of people taking us very seriously when we say, don't go out, don't gather, stay home, wear a mask. So it's a complex sort of nature of this. And I don't know if we'll ever truly know. Ginger, do you have additions to that?
I think that's a good summary, and our epidemiologists have been talking with Google and Apple about what metrics might be available, aggregate numbers of notifications that we might be able to look at to understand the impact of the app moving forward, but that won't be for several months.
Great, thank you. We will now take it over to John. And if anyone has a question, please use that raise hand function, and we'll go ahead and filter your questions that way. And John, before you start, if you don't mind saying what outlet you're with.
Yeah, hi guys, it's John Ingold from the Colorado Sun. Sarah, just a quick question here. I'm wondering if you have an estimate for how many Coloradans have smartphones that are capable of running this function or running this service. I know I've been getting messages from folks who are discovering their iPhones are too old to actually make this work.
Yes, so we estimate that 81% of Coloradans have a smartphone. From Google, we've determined that 99% of all Android users can enable the service. For iPhone, as long as you have an iPhone 6S or greater or newer and have upgraded to the most recent operating system, you can enable the service on iPhone. We know that there are still lots of folks in Colorado who have an iPhone 6 or older. And we continue to work really hard with Apple to understand how many people that is, and also work with them and encourage them to ensure that this service is available for everybody who has an iPhone, not just 6S or newer.
Great, thank you. Ray Solomon, I'm going to take it over to you, and if you could say what outlet you're with before you start.
Yeah, Ray Solomon with KUNC. And my question is, what does the notification look like? Does it tell you what to do if you're notified? And if you have any data on people who are notified, if they're responding appropriately, what they're doing with that information?
So the notification says the date that you were likely exposed and provides a link to public health information, including where to get tested. It links you to the CDPHE website, and it gives you information about how to safely quarantine, where to get tested, and how to take those protective actions. Again, I will say you can see, I believe, a screenshot of that on both Android and iPhone at addyourphone.com. So if you want to include that, that's the place to go to see it. The other thing I will say is because of the privacy protections and the privacy forward nature of the service, we do not know how many individuals have received the notifications nor what they do when they get it.
Great, thank you. Jessica, we're going to take it over to you.
Hey, it's Jessica with the Denver Post. I've heard from some people that they haven't received the notification on their phone, even if they have a newer model. Do you know why that might be and what they could do to get the app set up?
Yes. So one of the things that's super important to know is you don't have to wait for the push notification to enable the service. Even if you haven't gotten the push, if you're an iPhone user, go into your settings and enable it, or go, if you're an Android user, to the Play Store and download the app. Again, all of this is at addyourphone.com. If you're still struggling or you're really excited to receive the push notification, the two things that you can do that really are basic troubleshooting are make sure that your operating system is the most up-to-date one. So do that. And then, like all good tech, try turning your phone off and on again. At addyourphone.com, there's more information about troubleshooting, but really we're seeing the primary thing is people don't have the most recent operating system.
Great, thank you. Ray, we're going to take it back to you. And do you mind saying which outlet you're with? We missed that last time.
Yeah, sorry about that. I'm with KHN. This is Rael and Michelle. Yeah, so a number of other states allow people to mark an affiliation. So that can either be a university or it can be like a big area. It's an optional thing. Seems like a very useful measure. Why are we not providing people with that option, and or is that a possibility in the future?
This is another area where we're really trying to be privacy forward. We did a lot of stakeholding and a lot of engagement to understand how to increase utilization and enablement of the service, and that marking of a group or an affiliation was seen as a barrier to enablement, and we really want everyone to use it without barrier.
Great, thank you. Claire, Cleveland, I'm going to go ahead and take it over to you. If you could say what outlet you're with.
Yeah, hi, Claire Cleveland, Colorado Public Radio. So you had indicated that the 15% adoption could have a positive impact. Can you clarify though what the goal for uptake is, and how confident and kind of based on what data are you that there will be widespread adoption here in Colorado?
So we're already seeing widespread adoption. More than 500,000 people have enabled it. That's more than 15% of all mobile phone users. It's a huge win for Colorado already, and I thank everybody who did it. And from here, it's just more and more, and there really isn't a limit. Until everybody enables the technology, we're going to keep encouraging people to do it.
Great, thank you. It looks like, Sante, it looks like you are next.
Hi, this is Marianne Goodland. Can I get a quick question in?
Sure, Marianne, go ahead.
Can you email me that slide presentation? I appreciate you sending it to me to my phone, but unfortunately it won't let me to export it to somewhere where I can actually read it.
Yes, absolutely. We definitely will.
Thank you
No
very
worries.
much.
All right. Okay, now, Vicente, we're going to go ahead and take it over to you.
Okay, thank you, Vicente Arenas, Fox 31. Other than the adoption rate, what metric will you use or would you like to use to show that this is having at least some kind of impact?
Again, because of the really privacy forward and privacy heavy nature, we don't have a lot of metrics to evaluate aside from that enablement metric. We also will be tracking over time how many people request the link to send a notification. And once we have that data, we'll begin sharing it. But those will be really our two and primary and only metrics that we'll use to understand how it's working. It's a lot of faith and also a lot of modeling that we've done, and we're excited about it.
Great, and I'm gonna actually take it over. Megan Hiller, let's go ahead and have you ask your question. And if you could say what outlet it is.
Can you hear me?
Yes, we can hear you.
Okay, great. My name is Megan. I'm with KKTV in Colorado Springs. I just have two quick questions. I know you guys are talking a lot about privacy, and I know that's a huge concern for a lot of people. So maybe how are people's privacy protected when it comes to this? And can you just, in layman's terms, maybe walk me through how the notifications are given, how they're sent out, what goes into them being sent out, stuff like that?
Sure. Let me take those in two parts. So the first thing is about general privacy. So the service operates on Bluetooth, and the fundamental technology is that in a periodic nature, the phone in which the service is enabled generates a random string of letters and numbers. We call that tokens. And using Bluetooth, it sends that code out. And if another phone is in close proximity that has the service enabled, it too will generate that token and send it out. Phones also are able to receive and store those tokens for 14 days from the time in which it happened, in which the exchange of tokens happened. So that's the fundamental technology. Moving into then how that gets activated to notify somebody that they might have been exposed. So when an individual, let's say, we like to use this example of Bob and Alice. Let's say Bob and Alice are in line somewhere and they end up talking for a long time. They haven't seen each other in ages. They went to high school together, let's say. So Bob and Alice are talking, and in the background, their phones are exchanging these randomized tokens. Then they go about their ways. They didn't actually exchange phone numbers. They're not friends on Facebook. They don't know how to find each other again. So they go about their business. And a couple of days later, Bob's feeling really poorly, and he gets a COVID test, and it comes back positive. A public health professional, case investigator, and contact tracer will call him. And in the course of the case investigation and contact tracing conversation, that case investigator or contact tracer will say, "Hey, Bob, do you happen to have exposure notifications enabled on your phone?" And if he says yes, that person will say, "Would you like to send a notification that people might have been exposed to COVID?" He can say yes or no. If he says yes, that case investigator or contact tracer will send him a text message to his mobile phone with a link that allows Bob to go through a 3-question process and approve to alert the phones that he exchanged tokens with that the person who has that phone might have been exposed to COVID. So that's sort of how the process works. It's a little bit obtuse, and part of the obtuseness of it is that it's really privacy protected. Megan, did that answer your question?
Yes, thank you so much.
Great.
Great, thank you, Megan. Ray Solomon, we're gonna take it over to you.
Actually, you answered my question in your response to the last question, so I'll pass.
Oh, good, wonderful. Then we have our other Ray. Ray, I'm gonna go ahead and unmute you and you can go ahead and ask your question.
Thank you. This is the other Ray with Kaiser Health News. And thank you for taking another question. So, human behavior is a real question mark in all of this pandemic. I'm kind of curious, like, what is your expectation of what people will do? Like, say you have 100 people who are Coloradans with this app. They test positive for COVID-19. They get those PIN codes to send exposure notifications to people they may have exposed. How many of those 100 do you expect will follow through and will actually notify their contacts?
Given that it's really new in Colorado and we're not closely tracking the data, but we're opting instead for privacy protection, I don't think we have a clear sense. I do think, though, that people are empathetic and active in their protection of others in COVID. And so I have hope that the vast majority of Coloradans will take this opportunity to give this gift of exposure notification to other people, because that's really what it is. It's giving somebody else the gift of giving them key information that allows them to protect themselves, to protect their families, their friends, their coworkers, and their communities. And I believe Coloradans will do it.
Great, thank you. Sante, we're going to take it back over to you again.
Okay, thank you. I just wanted to clarify something. So in order for someone to let people know that they have tested positive for COVID-19, you first have to, I think you said, get a PIN code. And this would prevent people from just being really mean and giving bad information. You have to have a PIN code, right? Before you can send that notification out. Is that correct?
You have to have a positive test, and then you get a link to enable the service from a public health professional. So yeah, we do have very robust protections in place for that mean behavior or that spoofing behavior that people are concerned about. It isn't possible because that is, it's sort of a one-to-one. You have to have a positive test result. You have to get the link from a public health professional, and that link is used once. So you can't spoof it in that way.
Great, thank you. Sonia, I'm going to take it over to you. If you could say what outlet you're with.
Yes, my name is Sonia Gutierrez. I'm with 9 News.
Oh, I'm sorry. I think we might have accidentally muted you.
I'm still on mute, sorry.
Oh,
Sonia
there you go.
with 9
Okay.
News. I have a follow-up to Vicente's, and then I have my own question. My follow-up would be, say I go back into the app and then I submit my test. Do the people that I've been around get the notification with my name, or does it just say vaguely, someone you've been around has tested positive for COVID? That's my follow-up to Vicente. And then my own question is regarding the COVID tracking system. How many people need to sign up for this to be effective? I know that this kind of thrives on participation. And how many people have signed up so far? Do people need to sign up a little bit more for it to be effective here in Colorado, or anything helps at this point?
So the first part of your question is an individual doesn't enter their test information into the app. Rather, when you test, it is part of our protocol that when you test positive, you're given a call from a case investigator or contact tracer. And that individual will verify your test result and will ask you if you want to notify. If you want to notify, they will text message you a link. You will then click that link, answer 3 questions, and the notification goes out. It's a one-time link. So you actually don't enter in your test information. No test information is ever associated with the app or the service. The next question is about adoption. So any level of adoption is beneficial in reducing transmission and fatalities. We've seen modeling from Oxford University that indicates if 15% of a population can enable the technology, we can reduce transmission by 8% and fatalities by 6%. Currently, 10% of the total population of Colorado has enabled that service. That was of about 9 p.m. yesterday, so it's a little bit more today. We want to encourage everybody to enable this service. We don't hit a magic threshold at 15% where nobody else has to do it, The more people who are in this, the more people who add their phone to the fight against COVID, the more protection we all get. So everyone should do it, and the sky is the limit, or the population is the limit, really.
And then just one follow-up to that. So if say I do opt in to let people know that, I tested positive, do they get a text message saying, Sonia, who you've been around, tested positive, or is it anonymous?
Thank you for asking that. I apologize, I missed it. It is completely anonymous. No one knows. The notification, which you can see an example of at addyourphone.com, says the date which you might have been exposed and links you to public health information. It never discloses and never knows who you were exposed to or where that exposure happened.
Great,
thank you so much.
Ray. Oh, thank you. Ray Solomon, I'm going to take it over to you.
Thanks again, Ray Solomon, KUNC. I wanted to know, are the notifications limited to first degree exposures? Because one of the things we know about this disease is people can get exposed and there's a delay in getting the test results. So let's say, was it Bob and Alice? Let's say Bob sends out his notification. Alice was sitting next to him on the bench. She gets it maybe 7 days after she was on the bench with Bob. But meanwhile, she's, gone to see her sister, Deborah. Does Deborah get the notification that there's been a second degree possible exposure?
No, Deborah would not get that exposure. It would be incumbent upon a second level, hopefully. Both Alice and Deborah would have had the exposure notifications turned on, and then Alice would notify Deborah. Also, this is a many-layered process. So in the process of doing case investigation and contact tracing with Alice, hopefully we discover that she spent time with her sister Deborah, and we could then do traditional case notification, or we encourage people to tell their friends and family if they feel comfortable and they feel safe that they might have been exposed. Again, it's a gift you give others. Did that answer your question?
Yeah, thanks.
Great, thank you. And then Ray, you guys just keep going back to back, makes it easy. Your turn.
Thank you. Ray Ellen Bichelle with KHN, Kaiser Health News. A couple questions here. My understanding is we're hosting these codes on the APHL server, and that means that if I have the Colorado app, but I go on vacation in Wyoming, I could still notify my exposures in Wyoming were I later to test positive. Can you confirm if that's the case? And somewhat related, are there specific, can you talk a little about your marketing strategy, if there is one, if there's a budget for that? Like, are you going to try to focus this on certain populations or ski resorts, given how, they were spreading COVID all over the place early on? Both of those, I'd love to hear your thoughts.
So on the first question, we're working incredibly hard to facilitate interoperability with all other exposure notifications technologies. Some other communities are using, other states are using EN Express, which is the service we use. Those will be immediately interoperable, and those that are different, we are working to ensure rapid interoperability. It's super important for all of us. On the second conversation about communications, marketing, and getting the information out about this, we have a really robust, multi-pronged strategy to help inform people about this technology, how private it is, and how they can use it and what the benefits are. That is some paid advertising. I think people have seen commercials for exposure notifications. We're super excited about that. But we're especially doubling, tripling, quadrupling down on meeting people where they are and going through community organizations, trusted entities to meet our frontline workers, our communities of color, our communities of faith, tourists, and service industry workers, really where they are. We know that those communities have either higher and disproportionate rates of transmission, exposure, or have the potential to not have the full availability of all the other strategies. So we're getting really good feedback, especially from our communities of faith, service workers, the tourism industry, about this and as another layer in our strategy to fight COVID. And so we're really working on that. And this will be an ongoing effort to ensure everybody has it. Obviously, we want everyone to enable this technology today if they haven't already, but we'll continue advertising, we'll continue engaging, and it's a regular part of our messaging. And then the last thing on the tourism part is we know a huge portion of our economy is dependent on our winter tourism, and this is a great tool in that toolbox. It's not a silver bullet, but it's a tool. So we're working with our partners at Denver International Airport, for example, to ensure that when people arrive in Colorado, they get the message that exposure notifications is available to them and they are able to engage it. So we're really excited about that, and it's another tool in our toolbox.
Great, thank you. Janet, I'm going to take it over to you if you could say what outlet you're with.
Yeah, hi, it's Janet with 9 News. I was just wondering if I tested positive today, does the notification go like backwards? For example, like I might not have had I'm sorry, I might have been contagious prior to testing positive or getting the positive results. Would it notify people I might have been in contact with 3-4 days ago, or does it go forward from the test result?
It goes retrospective from the moment you enable the technology, and then it only stores the tokens you receive on your phone for 14 days. So if you enabled the service on Sunday and you tested positive today and were able to send an exposure notification, it would be those individuals or those phones with whom you exchanged tokens since you enabled the service.
Okay, so it would potentially reach those people that you were in contact with before the date on which you tested positive.
100%. That's the key to this technology, is we want it to notify those individuals who we might not know, whose contact information we might not have, and who we've come in contact with while we might not have known that we were sick and shedding virus. Exactly.
Great, thank you. Ray, before I take it back over to you, is there anyone who hasn't asked a question that would like to before I take it back over to Ray?
I've got a couple of questions. This is Mary in Goodland with Colorado Politics. Do you have a breakdown of this 587,000 folks, whether between those who have adopted via Apple and those who have adopted via Google?
We don't have those statistics yet, but when we do, we will absolutely share them.
Okay, thank you.
Great, thank you. Okay, Ray, I'm going to take it back over to you.
Thanks, Ray Ellen and Michelle with Kaiser Health News. I know I've talked with some states who have pretty good data around, you know, how many people have sent out notifications or how many, you know, they just have a lot of information. And I wonder if you can speak a little to that. Like, is that because they're not using the Express version, like they have their own app? I'm just trying to help me understand, like, what's the challenge that we're up against that prevents us in Colorado from having the kind of detailed data breakdown that, say, North Dakota has?
So nothing prevents us from having it, except we made a deliberate decision not to have access to that. We really wanted to honor Colorado's independent spirit, opt-in nature, and incredible privacy protection that really makes us the Western wonder that we are. And so we made a choice in our implementation and in the technology that we chose to enable that really doesn't collect any data. We felt it was much more important to protect privacy first and have less data on the state side, because we really want more people to enable the service. And the research we did found that the less tracking data, actually no tracking data, was the way to facilitate the highest level of adoption. And we really made that decision in an informed way. And it was a trade-off we really wanted, because we'd rather save lives than have great data.
Great, thank you. Okay, we are almost out of time for today. So if anyone has any last burning questions, or if you would like to go ahead and send them over to media_info@state.co.us, we can help get you some answers. And if not, I'll ask if our participants have any last thing they want to add.
No, thank you so much for getting the word out. Enable the service, add your phone to the fight. Wear a mask, stay home, wash your hands.
Wonderful, thank you. And I also want to thank both our ASL interpreter for today, as well as our Spanish interpreter. And again, if you have anything you would like to ask, please go ahead and send that over to media_info@state.co.us, and we will send the presentation out afterwards. So if you weren't able to view it, you'll have those slides. And I hope you all have a wonderful day. Thank you for joining us.